Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, welcome back.
Do I get you again?
You got me again.
I love it. Well, can we talk a little bit about memory loss? I'd like to know about your patients. You know, you're a geriatric physician, and if anybody understands what's happened, I told you about this Dr. Watson, who's a clinical investigator, and one thing, you know, and I think you said this too, that when people were 65 and you were treating them, I mean, they died pretty soon after that, so you didn't notice the memory loss. But now they're 70, 80, 90, and what are
100.
people supposed to do, Dr. Mencia? What are they?
Well, you know, the first thing that we need to do is that what happened to your body, don't blame it to aging too quick. And that's the mistake, not only by us as patients, but many providers out there. They look at the patient and they really don't know what to tell them. They don't want to disappoint them and tell them, well, you know, this is it, you have to live that way. And they just say, you know, it's just part of aging, what's going on with you. And if you remember, there's a joke of the lady that goes to the doctor with the pain on the left knee. And the doctor said, oh, just go home, you know, take Tylenol, you'll be okay. The doctor is calling. Tylenol is not helping me. You better do something. Okay, take a leave. A leave is not helping me. Do something. And the doctor just got frustrated. And I say, Mrs. Schmidt, you are 88 years old. What do you expect? You know, a little ache and pain on your knees. He goes, how come my right knee is 88 years old? It doesn't bother me at all. Something is wrong with my knee. And she was right. She have a lot of fluid in there that needed to be taken out. So don't let people blame age.
And doctors do that, don't they?
Doctors and patients, unfortunately. Patients don't go to the doctor. I had a patient that came in and a retired lawyer. And he's sitting down, and I noticed on his pants that he's wet. Mm. So we're sitting down, and during the initial take, I said, well, how long you been having problems with controlling your urine? He said, how do you know that? I said, do you have a problem controlling the urine? He said, yes. But how do you know? I said, well, I'm a doctor. You are a lawyer? How do you know what you know? I'm a doctor. That's you know,
great.
That's what we do, you know. He goes like, wow, you are damn good, man. So, but I'm not telling him. I'm just, so he called me, you know, every time he coughed on his knees, you know, he said, coming to see you for the first time. I was nervous, of course. Did I bring all my medication? So I'm very, very nervous. So I said, yes, I noticed. So we went, and it just so happened that his prostate was enlarged. So we gave him a prescription with some supplement to shrink the prostate to help him out. And afterward, you see the guy that he will come in with dry pants. And I will ask him, well, you know, how you doing with the urine? He said, you know, that's doing really, really well. You know, whatever you have done for me. And we
how old was he, Dr. Mencia?
He was 74, 70, mid-70. And so, you know, sometimes you go to the doctor and your pants might not be wet, but you still see the marking that you're having a little problem around your pants, you know. Or when you get off from the exam table, the table might be a little bit wet.
So you observe this
so
because
that's what good clinicians supposed to be.
Yeah, well, that's what a geriatric physician does.
Right, you know, so sometimes you have to help the patient come out with the truth and just be frank and open. So when it comes to the memory, the first thing is don't blame your brain. Don't blame your age. You know, find out. There are many conditions that can affect your memory and make you feel that you are having Alzheimer when in reality you don't. It's what we call pseudo dementia. And pseudo dementia is when you have a medical condition that affects your concentration. For example, if you see a person when they are very depressed and you ask them to count backward or to do any task that have to do with concentration, they cannot do it. And they cannot do it because they are so depressed, they are with lack of energy to produce any task like that require concentration. But they are not dumb, they are not stupid, they don't have Alzheimer's. You treat the depression or you manage the depression with hypnotherapy or psychotherapy or what have you, and you see once they are up and alert, you can ask them those questions again and they respond. And Alzheimer's don't do that.
Okay, well, wait, you just tell me something very interesting. So anybody sitting there who thinks that they have some memory loss, if they can go 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, they don't have it?
They're very likely they don't.
Whoa,
Very
everybody.
likely they
So
don't.
let's see now. And if you can't, maybe you're depressed,
Right.
right?
You can be depressed.
I love that.
The other thing is if you have a thyroid issue and your thyroid is not properly controlled. Imagine when a person has what we call hypothyroidism, a sluggish thyroid. When your thyroid is sluggish, what happened to us clinically? We get a little swelling of the ankle. We get constipated. We get weak. And we look like a depressed person. But we are not depressed. It's just the thyroid, the function of the thyroid is metabolism. So it's like the carburetor in your car is not working. The rest of the car is great. You just have to clean that damn carburetor and everything is going to go back and work. So
But people can't tell themselves. They need an exam.
They need
don't
an
they?
exam to look at that. And, when I do the exam to the thyroid, I even include an ultrasound to make sure there's no nodules in there, there's no goiter, which is an enlarged thyroid, but it's not working. So I look for, I have detected a few thyroid cancer very early in stage, which, make me feel good because once I detect something in the thyroid that is at the tip of your finger right here on the bottom of your neck, once we detect a small cancer in the thyroid, we have saved a life already. Because the surgery is so simple. Just cutting the skin. Once you cut the skin on the base of the neck, the thyroid is a small gland that sits right there. But it controls the metabolism of your body. So when the thyroid is sluggish, we might need treatment to replace the hormones.
My mother had thyroid. I know she took some. What's the common thyroid medication?
Synthroid,
Yeah, she took that
levothyroxine.
for her no other medication but that for many, many years.
And there are people that like natural treatment, like Armour thyroid. But the treatment is there, synthetic or natural. The treatment is available for the thyroid. But the thyroid is one of those conditions that can make you think that you have Alzheimer's or that you are depressed, and you are neither. You just have a thyroid that need to be treated.
So so memory problems really can come from real memory that you are getting something,
Right.
some brain brain dysfunction, or they could come from just other kinds of illnesses.
Other kinds of illnesses. And, a good clinician, usually when they're going to treat a memory problem, they will do a good workup. And you'll be amazed, Anita, how many patients have come through my center and they come on treatment, not by a primary, by a neurologist, on treatment for memory disease, for Alzheimer's disease. And I look at the patient, and the patient is giving me a perfect history from the present and from the past. And we do testing and we do everything. And I start questioning how long will you put? Now, this is the patient speaking. Usually a person with Alzheimer's, there is a caregiver that will speak for the person. Most of the time or some of the time, they will have to help the patient come up with the answer. And And I usually look at my patient. So if let's say you are sitting on that chair and Bill is sitting on the other chair, and I ask you, Anita, what did you have for breakfast this morning? And you look at Bill. Bill, what did we have for breakfast this morning? We had the egg. So you are asking for confirmation that you are giving the right answer. Well, this lady come to me and they will come and she'll giving me the answer straight face to face. And I ask her, how long did it? So about a year. And what else was going on in your life at that time? Oh, my husband died. I was kind of lonely. The kids came by and they say I wasn't well, so they took me to my primary care doctor to be checked. The primary care doctor said I have memory problem. They sent me to the psychiatrist. Psychiatrist started me on medication.
Oh.
And I said, well, you were going through what we call a reactive depression when your husband died. And this is on the first interview, mind you. And I say, you were going through what we call a reactive depression when your
I never
husband
heard
died.
that term. I understand what that is. That's wonderful that you say that. Reactive depression.
I was a psychologist by training before I became
I
an
know
MD.
you were, but that's a wonderful reactive depression.
Reactive depression, which is not endogenous. It's not a real depression. So let's say your dog died, something very close to you passed on or get taken away from you, you will become depressed. But it's not real depression. With time, you will overcome that. Well, endogenous depression is the depression that comes out of no reason. There's no rhyme or reason why you feel depressed, why you are crying, So I say what you have is this reactive depression at that point in life. And she have already met somebody who was a good friend of her before her marriage. And she was doing well, and they are both sitting there. And I said, well, the first thing I want to do, I want to take you off from those medications. And the husband, the boyfriend goes, are you sure? And I said, I am positive. And the way we're going to do is trials and error. I could be wrong, but let's do trials and error. We're going to take one of the two medications and we're going to titrate it down. And you're going to watch her. You let me know if anything different happened as we're doing this. If you tell me that she started repeating herself, she's getting confused, we'll put her right back, and I promise you nothing will happen. If I'm wrong, we can fix it, we'll make it right, and she won't suffer any consequences with it. And that's what we did. We started titrating down. She has some vitamin deficiency. We supplemented the vitamin, and we titrated down. Eventually took her off the medication, and she continued to be the same woman without those two Alzheimer's. And not only that, with the stigma that she was walking around, say, I have Alzheimer's disease. And she was afraid to go to the bank or to do anything, that the bank will don't want to deal with you. You have to get a person to be assigned to handle your affair. And her whole life turned around. She got her independent back. And then, of course, the kids came by. They say, well, what's going on with Mom? She wants to have her own independent again. I say, well, she should have it all along. There's no reason she should not have lost her independence. That was a mistake by whoever was treating her a year back. But at this point in time, she was just going into a depression when your father died.
Dr.
And that's
Mencia,
normal.
Let me give your phone numbers again, because I hope everyone's understanding what we're doing here. For those of you who are really thinking about serious illnesses, and if you haven't had a second opinion, you are really being very foolish. Go and see Dr. Mencia. He is probably the smartest geriatric physician down here in South Florida, at least.
Thank you.
And you should do that. Not only is he charismatic and he's kind and loving, he's very smart. And I hope everyone listens to this radio show really will do that. Just go there. A second opinion is not your primary isn't going to be upset with you. Just go there. Make sure every medication you're on, everything you're thinking about as you're aging. Sit down with him. His phone number in Fort Lauderdale is 954-489-1345. He's located on East Commercial Boulevard, right near Holy Cross Hospital, and they have another place in Boynton Beach where he does go by appointment. You can meet with him there, and that's on Hagen Ranch Road. Their phone number is 561-270-6494, and home visit services are available for homebound patients. So even if you can't get to him, there'll be a way for him to come to you. And I really do, I've done this radio show for a long, long time, and I know that the reason I get here so early on Saturday mornings is because I know that I'm helping people. And if you would just go see Dr. Mencia, I would feel so happy to know that this has made a difference. And I really mean that. You've made such a difference in my life. Thank you know that with so many things that you've helped us with. And just off the subject, I still have to come and get a pneumonia shot. I haven't done that yet.
Yes, you got your flu shot already.
I have to do that. And then I'm going to listen to you. And after I get that down, after I've had my pneumonia, I will go ahead and have the that other shot. What's the shot is
the
for? Shingles, which
I
would never think about that. But you're feeling that it can't hurt me, and I ought to do it.
It won't hurt you, and it will. Yeah, it
just
would be
secure
beneficial.
it because it's pretty. We see it on television how horrible it is if you do get it.
Exactly,
right?
It is horrible.
So I'll do that. But anyway, getting back to what you're doing, Dr. Mencia, I think that what you do, and there's a saying that I like is, once you're a somebody, you should never be a nobody.
Exactly.
And that's what happens to older people. They're just treated, like you said. I'm sure so many people come into your office and your clinic, and the caregiver's there, the family member, and they want to do all the talking. But you stop it and you talk directly to the patient. A lot of doctors don't do that.
Exactly.
And that's so wrong. Hey, I'm here.
I'm here. And, the patient goes like, I used to go to that doctor, and I used to have to tell him that I am the patient. I am the patient. I would say, well, here you are the patient.
It's what they do with people in wheelchairs. I've told you about that before.
Exactly.
That once you're in a wheelchair, nobody talks to you. They talk to the pusher.
Right.
I mean, that's so wrong.
Exactly. And regardless of your age, you're on the wheelchair, they see somebody, they'll talk to that person.
And you've talked about having patients in their 90s, and I also believe, as you've been saying, that if you've taken care of your body and you've taken care of your mind as much as you can,
right,
and you have a good doctor.
And your emotions.
And
take care of your emotions. You have to be happy.
Yes.
You have to do those things that make you happy.
Attitude is everything, isn't it?
Right.
Yeah, I'm glad. I have a good attitude. Thank goodness I don't got it from my mother. But attitude does make a difference. We all look at things in a different way.
You can be getting a little cold, and if you become negative, it will take you down and put you in bed. I don't care if you weigh 300 pounds, it will take you down and put you in bed. If you have the right attitude and you are a fighter, you will overcome the little cold, and it will go away. It will just go away because your immune system will fight it.
And I have something I've been saving to tell you. If I get where I think I'm getting a cold, you're going to laugh at this. And then I just saw somebody wrote in the newspaper. I didn't know anybody even did it. I take Vicks and rub my feet with Vicks and put socks on.
Mm-hmm.
And I have to tell you, it really does work. And everyone laughs at me. And I just saw an article in the newspaper, New York Times, as a matter of fact, and someone said that. And the writer said, well, look, I have heard of it. I don't know. But this person said she does that, and it helps her cold. Now, explain that one to me, please.
You are doing something versus doing nothing. You have a cold, you take some Vicks, rub it on your chest. You are fighting. You put it on your feet, you are fighting. You put it around your temple area, you are doing something. You are fighting the cold. Versus the person say, oh my God, I came down with the cold. They take a towel or a robe and they sit down and they will get sick. So you have to fight it. You have to do something. So if you have the right attitude and you are willing to do something to fight a simple cold, you will overcome that without me. You don't need a doctor to overcome it.
Well, I know another thing. Find a lover.
Find a lover, that's right. Bring some energy.
That's right. I'm getting sick. I need a lover. Sorry, I had to add a little bit of levity.
But no, with just like with the memory, when you're thinking you're having memory problem, you have to ask yourself, like, what else is going on around my life that can be producing that? You don't have to be a doctor. Just ask yourself that. And if you find that, then try to have your doctor dissect that problem and see, is it real or is it something else? You can be having Alzheimer's disease or one of the 20 dementias plus we know of. But in order for us to find out, you have to be in the right hand. You have to be in a person that say, let me make sure that there is nothing organic going on. A person that is anemic will look like they have Alzheimer's, but you give them blood transfusion, you replace the hemoglobin, and they're back to normal. Why? Because hemoglobin transports oxygen, and your brain needs oxygen just like the muscle and the rest of your body. So when the person is too anemic and the blood count is too low, they don't have enough taxi to take people around, to take the oxygen particle around. So there are so many things that we look at before we even label somebody as having a true memory problem. And that's what makes us different as geriatrician versus somebody that just going to look at you and say, yeah, you have Alzheimer's, let's start treating you. It's the stigma behind that, once you have Alzheimer's, if you really do have Alzheimer's, it's a lot of things that we have to take care of for our personal life, our financial life moving forward. You have to decide. And a lot of people have the myth that if I'm diagnosed with Alzheimer's, that means I can no longer make a decision. Somebody else is going to have to make it for me. And that's not true. You still at the point, if it's mild, of determining who do you want to make decision for you. And I have some of my patients that say, doctor, I want to assign you the surrogate for my health.
Really?
Yeah.
And you can do that. You call that, is there a term for that?
Well, yeah. I mean, the
health surrogate
a
or
health
something?
surrogate. And because he didn't trust any of the kids. Any of the kids he wouldn't trust. And I didn't blame him. But he has the lawyer assigned as the, like Dr. Carp.
Like Joe Carp.
Joe Carp.
Right. That
he has the lawyer assigned as the surrogate for his finances.
That's
and I was the surrogate for his health.
That's excellent because, you just brought up the fact there are many people, as you said, family members that are very quick to take that person and do everything with them and say,
because he didn't want to be put into a nursing home.
And the judge listens to them, and they shouldn't.
Have to listen. They have to. Well, when you go into the court and the judge is there, if you don't have the right doctor to say, no, this person, that's one of my job as an expert witness is to go to court and talk on behalf of my patient.
Expert witness, yes.
When I go to court as an expert witness in geriatrics,
yep,
I have to educate the judge and tell the judge, listen, this person has mild Alzheimer's, which means that he does have the condition. But if you ask him what kind of ice cream you like, if he likes vanilla, push some chocolate on him, he's going to kick it right back. He's still able to make certain decisions. And with mild level, he should be able to determine what he wants for the future when he cannot make decision any longer.
Well, my decision is, I'm sorry, we've run out of time, but that was great. We have to talk about that a lot because I think people need to think in terms of having you as a health surrogate. I love that.
I think Richard pushed the clock too fast.
Well, we've had a wonderful time here together, and it's as usual.
I told Richard next time we're gonna stop the clock, and we're just gonna stay here until 8:00.
So, Dr. Mencia, thank you very much for much good information this morning. Reactive depression, and an expert witness, and health surrogates, and no, you don't have Alzheimer's. If you can go 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, I'm good. All right, we'll be back. We'll see you another time.
Bye, Anita.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.